Remember Fernando? Today we're going to take a more in-depth look at the type of treatment he chose for his obstructive sleep apnea, and we will also talk about some interesting alternatives to that treatment. I'm Jay, and this is Somnilopod. Hello, everyone. Welcome back. I hope you're doing well today. Now, in an earlier episode, we met Fernando. Fernando had gone to the Sleep Disorder Center because he was having some issues. He had some excessive daytime sleepiness. He was having some trouble with waking up a lot at night. His mood had been affected. He snored like a freight train. And he was eventually diagnosed with a disorder called obstructive sleep apnea. It is a very common disorder, and the treatment that he chose, after talking with his doctor, was the use of a device called CPAP, C-P-A-P. It stands for Continuous Positive Airway Pressure. Now, this is a form of therapy that's been around for quite some time, and it has had many tweaks over the years. For the most part, it is basically just the use of room air that is pulled in through a machine that sits on the bedside table and blows it out through a mask that the patient wears while they're sleeping. Sounds a little complicated, but fortunately, technology being what it is, they've gotten really good at delivering the pressure in different ways and making it comfortable via the interface, the mask that the patient wears while they're sleeping. So Fernando, when he has a follow-up appointment with his doctor, he'd been having some issues. He was having some trouble with the mask that he chose the night of his initial diagnostic testing, or his initial treatment testing. For the most part, when the patient comes into the Sleep Disorder Center, the technologist that works with them will show them several styles of masks and find the one that's the most comfortable for the patient. The patient will wear that style that night during the testing, and then they're usually set up with that style to use at home for several months, just to make sure that it works. In some cases, patients will have some issues with that mask. Reasons being, you sleep differently at home than you do in the Sleep Disorder Center. So he may not have been as mobile as he usually is in the Sleep Disorder Center. He may turn and sleep a little more differently on his side than he did when he was in the lab. So he developed some issues with leaks of air with the mask that he chose. So he's going to come back in, and we're going to do a different mask fit for him. Now, there are 3 basic styles of masks that patients use with CPAP therapy. I'm going to start from smallest to largest and talk about some of the benefits as well as some of the disadvantages of some of those styles. So initially, the smallest style mask will be a nasal pillow type mask. This is something that just rests right on the end of the nose. There are variations on this style. Originally, the pillows themselves formed a small circle around each of the nares on the nose to help create a seal. They didn't go inside the nose, but they did rest right on the outside, and they conform to the shape of the nares to help create a good seal for the patient. One of the benefits of this type of mask is that it is very small. It doesn't have anything that will come up in front of your eyes. Very minimally will the headgear comes across the cheek to help hold it in place, and then usually fits almost like a baseball cap on the back of your head to help hold it in place. Some patients prefer this style, especially patients who tend to have a little bit of claustrophobia. Because you can imagine strapping something to your face at night can be a little daunting for some people. So they want to try to use something a little smaller. One of the disadvantages of this style mask is that the way it delivers the pressure is directly into the nose. So some patients will have some issues with dryness in the nose. So they may need to use their humidifier a little bit more. They may have to refill it at least daily because they've used it up the night previously, just because they have to have it on a higher setting because that air pressure is so direct. Next up from the nasal pillow style mask would be just a regular nasal mask. These masks go around the nose and they just rest right up at the top near the bridge of the nose and then come right below the bottom of the nose. And they usually do a really good job of creating a good seal depending upon the shape of the patient's face. Of course, there are no two faces that are the same, so no two masks will work the same for everybody. With the nasal style mask, this is the type that's been around the longest. So they've had plenty of opportunities to work with it and tweak it and make it more comfortable and make it lighter. So you can find styles that are very minimal, much like the nasal pillows. The headgear will hold the mask out to the side of the face so that you don't have anything coming up. You can still wear your glasses if you want to read at night or if you watch television at night before you go to sleep. You don't have any issues with things occluding your face. There are some styles that have an additional piece of tubing that is very light that attaches to the main type of tubing so that you don't have the heavy tube pulling on the mask in one direction or the other. Some of them even have headgear that holds the mask up at the top of your head so that you don't have to deal with turning from side to side and having to move that and drag that with you. Another alternative is the full face mask. Now that sounds a little bit daunting, but it actually is the best option for some people, simply because some people can't breathe through their nose. If you've ever been in a fight when you were a kid and you had your nose broken, you may have a little bit of trouble breathing through that. If you've got a deviated septum or if you just have severe allergies, you may not be able to breathe comfortably with either the nasal style mask or the nasal pillow style mask. So the full face mask actually covers both the nose and the mouth. Now these masks are a little bit bigger, so that can be a little intimidating for some people, but it does allow you to breathe through your mouth and get the full benefit of the pressure. One of the drawbacks of the full face style is that as the mask gets bigger and covers more surface area, you have a more likelihood of having a leak of air. So a lot of patients with full face masks will have to play with their adjustment of the mask at home, tighten one side, loosen another, play with it just a little bit to get it to where it is comfortable for them. And a lot of patients that we see will sleep on their side. So with the full face mask, anytime you turn to your side, you're going to have to readjust that mask a little bit, simply because the shape of your face will change when you push it against the pillow. So there are some drawbacks to the full face mask. Now, the manufacturers of these types of masks got smart and they decided, you know what? Some of these patients with the full face mask want to keep their glasses on, or they don't like that piece coming up over their nose. So they developed what's called a hybrid mask. This is a mask that covers the mouth, and at the top of this mask, it rests right up underneath the nose. So it has a little divot in the mask to help deliver the pressure through the nose as well. It does this without having anything come up past the bottom of your nose onto your face. So you don't have anything up on your cheeks, up on your forehead to help hold it in place. It's a good alternative for especially claustrophobic patients who have trouble with that full face style mask. It is a very, very good option for them. So once a patient has tried all of these different styles of masks, what happens if they just can't keep using it? Well, there are alternatives to CPAP therapy. Most physicians will start out with CPAP therapy because we know that it is the gold standard. We know that it works. We know that it takes care of the sleep apnea. It does the trick. Some patients just simply have that trouble with the interface, with the mask itself. Some people will have trouble with the pressure, with the way the air is blowing, but for the most part, we can make adjustments to make that more comfortable. The machines have gotten really high tech, so it can deliver the breath, it can deliver the pressure with each breath a little bit differently to make it more comfortable. So usually the feel of the pressure is not so much the issue, especially after several months of using the unit. Mask is typically where you'll see some trouble. So fortunately, there are some alternatives to the use of CPAP. Many of them will involve a mouthpiece, either a tongue retention device or a mandibular advancement device. Now, both of these types are mouthpieces that you would wear. One of them pulls the tongue forward. It's got like a little suction cup in it that you sort of stick your tongue in, and it pulls the tongue forward. Theory behind it is that if the tongue doesn't drop back into the back of the throat with the muscle relaxation that happens with sleep apnea, then the airway will stay open and it will help alleviate your sleep apnea. Similar theory behind mandibular advancement devices. They are mouthpieces that help move the jaw forward. So if the jaw is moved forward, then the tongue is moved forward as well. Both of those types of devices work better with mild cases of sleep apnea. And when we say mild, typically anything below 15 times per hour, 15 respiratory events per hour that the patient would see during their diagnostic study. They can go up to being effective up to about 20 to 22 times per hour. But when you start to get above that, there's only so much movement that you can do with the tongue. So you can't really pull your jaw that far forward to help alleviate some of that pressure or some of that relaxation. There are also some surgical alternatives. One of the previously seen and utilized procedures was called UPPP. That stands for uvulopalatopharyngoplasty. And it is basically a removal of some of the tissue in the back of the throat. And again, the theory behind that is if there is less tissue back there, when the muscle tone relaxes, the airway doesn't close off. So it can help with certain patients. Now, you always have to be leery of surgical alternatives, especially when they're removing tissue, because again, there's only so much tissue that you can remove. So if the obstruction is happening further down in the airway, then that's not necessarily going to be the best option for you. Interestingly, there is a relatively new procedure on the market called Inspire. And the Inspire device is an implantable device like a pacemaker. And it actually stimulates the muscles in the back of the tongue each time you breathe to help increase that muscle tone. So we've seen some interesting results with this type of therapy. We are actually going to do a full episode on Inspire. We'll have some of the Inspire people meet with us and give us some of the information about it. I just think it's a fascinating alternative to CPAP therapy. But again, it is one of those things that if you've tried CPAP and just simply failed, then it is going to be an option for you. But CPAP is usually the first best bet to try for your treatment of your obstructive sleep apnea. I hope this has been informative for you and educational. As always, please reach out to me with questions, comments. You can contact me at j@somnilopod.com. You can also follow me on Instagram, Facebook, Twitter. And until next time, I hope you get some rest. Thanks.